Now we're going to talk about peptic ulcer disease. And peptic ulcer disease can occur on the esophagus, the stomach, and the duodenum. The most causative agent is H. pylori that causes ulcers. And we're going to go into a little more depth on that. To prevent peptic ulcer disease, clients should be taught to limit alcohol, stop smoking, limit NSAIDs, limit caffeine, exercise, and reduce stress, which can all cause ulcers to form. So with the symptoms, patients are going to complain of burning, fatigue, heartburn, vomiting, bloating, burping. And there's kind of a difference between a gastric ulcer and a duodenal ulcer. So with gastric ulcers, the pain occurs 30 to 60 minutes after eating. Okay, they're going to be more malnourished because they do get pain after eating, so they don't like to eat. And they can also have hematemesis, which is throwing up the coffee ground or bright red blood. Duodenal ulcers have pain 1.5 to 3 hours after eating. They usually awake in the night. The pain is relieved by eating, so they're well nourished, and they can have melena, which is dark tarry stools. Okay, for a diagnosis, there are a couple of tests they will do. They'll do an H. pylori blood test. They can do an H. pylori stool test, and also a urea breath test for H. pylori. EGD, which is an upper endoscopy, it looks at the esophagus, the gastric area, and the duodenum to see where the ulcers are. And also, if the ulcers were bleeding, they could squirt, when they're doing an EGD, they can squirt a little epinephrine into the ulcer and stop it from bleeding. And remember, you have to check the gag reflex after somebody has that. Barium swallow could be done. And the big thing with barium is they're going to need laxatives after they take barium because you want them to expel the barium and not have a bowel obstruction. And CAT scan is another option as well. One of the complications of peptic ulcer disease is bleeding. So look for dark tarry stools, bright red blood in stools, abdominal bloating, hematemesis, tachycardia, tachypnea, and hypotension. Now those are signs of hypovolemic shock. Tachycardia is going to come first, then tachypnea, then hypotension. Patient will be complaining of thirst. They'll have a narrow pulse pressure, meaning the systolic and diastolic pressure are becoming closer together. The treatment involves medications, so they could be put on PPIs, which are taken once a day, not PRN, antibiotics for the H. pylori, H2 blockers, they can be put on those. Bismuth, remember, that has aspirin in it, so you have to watch out for salicylate poisoning, and it turns the stool black. And then acids. Okay, so usually students know all the indications and contraindications with these meds. Another complication is perforation. So the patient's going to complain of severe epigastric pain. Usually it radiates to the right shoulder. They'll have either hyperactive, so borborygmi, or hypoactive bowel sounds. They'll have a tender, board-like, rigid abdomen, and they will suffer from septic shock because the gastric contents are going to go into the abdominal cavity. So look for tachycardia first, then tachypnea, then low blood pressure, and possibly a fever. A complication of peptic ulcer disease could be pernicious anemia. That's deficiency of B12. So it happens because the gastric cells, the parietal cells, secrete intrinsic factor. When they are damaged or they can no longer do that. So the patient is going to have signs and symptoms of anemia. The difference between like iron deficiency anemia and B12 anemia is they have neurological symptoms in pernicious anemia. For example, they have tingling in their hands and feet. They have cognitive difficulties. They can become weak, but they can have that too in iron deficiency anemia. So they're going to need B12 injections for the rest of their life. And pernicious anemia is the type of anemia that presents with glottitis, so a red, beefy tongue is another symptom of pernicious anemia. Some patients with ulcers are going to need a gastrectomy. And after a gastrectomy, one of the complications is dumping syndrome. This can also occur after bariatric surgery, which I'm talking about later in this presentation, so I'm just going to present it here. So it happens after they eat, and it's caused by a rapid shift of fluids in the abdomen, and also from eating high carbohydrate meals. And this fluid shift causes the gastric contents to empty very rapidly. That's why they call it dumping syndrome. So the patient is going to, after they eat, they'll have tachycardia, cramps, diarrhea, dizziness, diaphoresis, palpitations, and fatigue. It's quite uncomfortable for them. So to prevent dumping syndrome and also to teach the patient, you would teach them these key points. They need to withhold PO fluids during a meal. So they should have liquids either an hour before or an hour after a meal, not with a meal. Drink fluids between meals, not with meals. And it's caused by eating refined sugar, so they need to limit sweet drinks, so like sodas, etc., juice. Avoid milk products, avoid simple sugars and milk products. They should change their eating habits to eat 6 small meals a day, eat slowly, and chew well. They need to lie down after meals to slow their stomach emptying. And this is different than GERD, so don't get that confused. They need to be on a high protein because protein stays in your stomach longer. So it's a strategy, and so does fat. So it's a strategy to help food stay in your stomach longer. So high protein, high fat, low fiber, and low carb. Gastritis is inflammation of the stomach lining. And there's acute and chronic versions. There's also non-erosive, which is caused by H. pylori, and erosive, which is caused by like your NSAIDs, alcohol, radiation, smoking, too much caffeine. And the complication is gastric bleeding, like they could have a massive hemorrhage if they have chronic gastritis. They can also suffer, people with gastritis, from pernicious anemia. They have the same signs and symptoms as somebody with an ulcer, so you don't have to memorize a bunch of different things.